It's Dr. Sandra Cremers, and I want to talk to you today about Lipiflow. So you've heard some of my videos before talking about the importance of the meibomian glands. And so just to quickly show you what meibomian glands are one more time and then how Lipiflow works. So these are the white lines filled with oil. I compare them to white piano keys. We want to look like this until we're 90, 100 years old. I've had many patients actually that look like this and they're in their 90s. A friend of mine came in recently, just got her first dumb phone, and she looks like this and she's 90. So I really believe that cell phones and computers are a big factor. We know that aging can cause these glands to decrease. I tell patients that if they have one gland gone, then they should think about Lipiflow. So there's 3 ways to save the glands. The first is warm compresses, frequent blinking, talking with your eyes closed, washing your eyes when you wash your hands, massaging, artificial tears, omega-3. Those are the first kind of ways to help save your glands. The second and the only FDA-approved way is called Lipiflow, which I'm going to have today to show you how easy and comfortable it is. So Lipiflow is an FDA-approved device. It looks like this. The device is sterile, and it's a device where the kind of head of the device goes onto the surface of the eye, does not scratch the cornea. There's never been a report of corneal abrasion that I know of in the world. Then there's a kind of a diaphragm that essentially is going to go around both eyelids. It's done both eyes at the same time, so all 4 eyelids, to massage the oil and to basically heat the lid so the oil gets more liquidy and then the oil is expressed out. The heat goes up to 108 degrees Fahrenheit, which is 10 degrees more than your body heat. And then the compression goes to 5.5 psi. So a normal blink is about 1.5 psi. A hard blink is a little bit more. Lipiflow provides even more compression, like a milking machine. So it's going to change out your oil, kind of like an expensive oil change, but it's worth it. So when patients have lost a gland, I recommend Lipiflow. And then the third way to save the glands that we have is IPL, or intense pulse light, and probing for patients often like this, or if Lipiflow did not help. And those are expensive procedures. They're not fun. They are painful. But we've had so many patients coming in for this that we do recommend Lipiflow. So we're going to go ahead and get started. A couple more things I just want to mention. There are 30 plus articles, peer-reviewed articles, about 5 on Lipiflow, which is great. So we have a lot of documentation. More than 200,000 patients have had this worldwide. The idea is that the oil is super important in preventing evaporation of your tear film. So if you think of a cup of water in the sun, it'll evaporate, but if you put oil on top of that cup of water, it'll protect the water from evaporating. So that's the same thing that this is doing. It's trying to just change out the oil so the oil is there to protect evaporation of your tear film. And we're gonna go ahead and get started.
It's actually on the top of the eyelid. And there is one right here, that's in the lower eyelid, and that's actually in the outside. The little thing that I inserted in the eye protects the cornea of the eye, so there's no heat that is going to create any problems. So what it's doing is just performing a self-test to make sure that everything is working properly.
So what I'm feeling is a little bit of pressure on the eyelids, as if like it's starting to clamp down a bit, but it's not painful. And now the heat is starting to increase, but it's not painful.
And as you can see right here, it shows the PSI, the pressure.
What is the PSI right now?
1.5.
Okay, it feels actually really interesting.
It's going up now, 3.3 in the right, 3.0 in the left. It's heating up. So that's the right, the left, and it's heating up. The first time that you have Lipiflow?
Yes, it is. And I wanted to have this to show patients that it's not scary, it's not painful. And I have noticed my glands slightly decreasing through the last few years we've had the meibography. Partly, I think, because of aging or using the screen too much to do research to publish on the loss of meibomian glands from screen time. It's very ironic. No, it doesn't hurt at all, actually. It's fine.
Okay, you can look up. It comes right off.
Great.
See? And you look up. Comes right off.
Great.
There you go.
Okay, Jen, you did great.
Oh,
So this was my first Lipiflow, and the studies show that the effect of a Lipiflow will last about 12 to 18 months, depending on how often you do warm compresses. Everybody in my office knows I'm a crazy person about washing my eyes. I usually come out of the bathroom having washed my hands and my eyes. And so if you do that every day, twice or 3 times a day, the effect of the Lipiflow can even last up to 2 years. So it is very effective. We have some patients that get Lipiflow twice a year because they don't have time to do the warm compresses and they're constantly on the computer. So I highly recommend Lipiflow. If you have any questions or ever want to hear more about Lipiflow, please check out my blog, which is eyedoc2020@blogspot.com. And we're visionary eye doctors in Washington, D.C. and in Rockville. And so please let us know if you have any questions. Thanks for joining us.